you said it's in the bill, and that's what it meant, that is the intent, is just inserting it in this section on page 3 in reference to this, so that this is more to protect you guys, to be honest with you.
Yeah, I was just making sure that my assumption was that only the things after be it enacted go in the code. The short title is what you're amending there, so I just wanted to make sure I was correct earlier. But please go ahead, please proceed.
On page 4, delete lines 9 to 11, and simply because, again, and we had this long discussion, and for those of you who are legal minds with degrees in practicing law, I just don't believe that your personal opinion should be put into law. And then you're going to go to court and expect for a judge to interpret it. And when you start talking about that these centers are not operating, that they don't treat the patients the same, all of that is conjecture. It is an assumption. How many of you men went to abortion clinics to know for sure? Senator Beecham, you're the sponsor.
I'm listening to you.
Okay, I'm just asking. Have you been to one to know for sure? Again, you have not collected any personal data of your own. It's not that you said, okay, I've been there with several women, and I know for a fact that's how they treat it. But again, the reason I'm asking that be taken out, and that doesn't do anything to the heart of the bill, it simply takes out somebody's personal opinion. Because if you're putting that in and expecting a judge to make a decision based on your personal opinion, I think that's wrong. On page 4, line 27, after the word process, add the following. And for those of you who don't have that, it says, starting with subsection 7, it says, because abortion and reproductive health centers do not currently provide the level of personal contact found in many physicians and patient relationships and other medical care settings, it is necessary for the legislature to mandate the process, the personal presence and participation of the physician in this process. And I'm saying to add, and these standards of participation shall not exceed current medical standards as defined by the State Board of Health Division of Licensure and Certification. Again, I think it's a friendly amendment. It's not changing the bill. I think it is clarifying it. Because what it is saying, while whoever wrote this tended to add their personal opinion, that you feel that the level of contact that is found in many physicians' offices, and quite frankly, the last time I went to see my doctor, I won't tell you what I had, but never mind. I don't remember him ever sitting down with me and explaining the procedure or even talking to me afterwards.
You need to go to my doctor.
You probably go to a male doctor for male problems,
I don't want that guy.
male stuff.
But they did when my son had his wisdom teeth cut out. They
Well, I mean, you could have gone.
tell you the whole thing.
I can tell you this was for a colonoscopy, so. Yeah. Anyhow.
I'm almost to that age.
Well, I mean, yeah, but the point is, almost, hey, you better go check. But the point is that, you know, they give you a little card and send it to you afterwards about the doctor's bedside manners. I graded him down on everything, and this was in a hospital. Did he come and talk to you about the procedure? No, he walked past several times, and he didn't come back in, no. I know the doctor. But he has terrible bedside manner. So again, in this, you're saying that because the doctor doesn't have the level of personal contact, well, hey.
I agree with you. We need to address that.
So all I'm saying is that add to this, and I consider these friendly amendments, when it gets down to participation of the doctor, the physician in the process, these standards that we're talking about, of participation shall not exceed current medical standards as defined by the State Board of Health Division of Licensure and Certification. I think that's a friendly amendment. Again, not trying to kill it. I'm trying to clarify, and I want to make sure that women's health, if it's about safety, it's about safety. On page 7, line 10. Line 10 refers to registered professional nurse. This is to add a new subsection. After this, it says a person currently licensed in the state of Alabama pursuant to section. Add a new subsection here. Just said after line 10, add the following new subsection 4 and renumber. This act shall not apply to any abortion or reproductive health centers that are currently existing as of this day. So right now, yes, we're talking about grandfathering those that are currently in, which I guess is down to 4 now. So if that's the case, and the health department regulates these, and they have to meet these standards, but anybody else coming in will meet the standards if this passes, these standards.
That fifth one, are they not, the one that's closed?
Well, as I understand, they're in the process, they're looking at, well, I understand the health department gonna close them down.
Yeah, I thought they were operating even though they weren't supposed to be. But I could be wrong.
Well, I don't know. From what I understand, that's his report. But that's not for me to decide. But the point is that if we cut out all these clinics, and there are only 4 in the entire state of Alabama, you are cutting off access to all the women that don't have any other choice. And I think women should have choice. Moving on down, on page 9, lines 15 through 27, to delete that in its entirety. And the reason being is because these are not ambulatory. These are not ambulatory centers. The health department does not define them as ambulatory centers. They are more like a small doctor's office as they have defined them. And they should not be put in this same category. So somehow, that needs to be redefined. And again, we talked about the instances as far as deficiencies of health and safety regulations and the violations that ambulatory centers have had as opposed to reproductive centers that are regulated and inspected every year. And the ambulatory centers are inspected every 8 years, and they have 3 times as many violations. The last thing is on page 12. And I'd like us to take each one of these individually and vote on if you're going to do it. On page 12, line 13, after the word act, add the following. Because in this section, we hold them to a higher standard than what other doctors, any doctor, is being held to. And I can't understand that. So in this, add the following in conformity with the Alabama Medical Liability Act. And that is the act that all physicians come under. If there's a lawsuit, that's the act that governs them, and that's the act by which lawsuits are brought.